So today we are going to talk about contraception, and this video is talking about all the different contraceptive options, because when it comes to thinking about what do you want, it can be so baffling. You've got coils, pills, injectables, implants, condoms. How do you decide what's best for you? Well, one of the main things naturally we all do is discuss it with our friends, mums, sisters, nanas, cousins, all sorts. And that's really good. Absolutely I would encourage that. But what I would say is what may have worked for them may not work for you. And equally, what hasn't worked for them might suit you. So don't rule anything out before we even get through the door. So, how do you decide? Well, let's split contraception up into two groups: hormonal methods and methods without hormones. So let's talk about the methods without hormones first. So, if you absolutely do not want a family, or your family is complete, you may consider something permanent like sterilisation. This can be in the form of a male vasectomy or female sterilisation, where you get your tubes tied, or the newer methods such as e-sure. But you have to be really sure of your decision, because these methods are not reversible. They wouldn't normally be done in sexual health or family planning clinics. You would usually need your GP to refer you. So what are your other options? Well, condoms. Condoms are fantastic at preventing against sexually transmitted infections. As a contraceptive, they're good, but we can do better. So if you definitely don't want a baby, I wouldn't be relying just on condoms. So what does that leave you? Well, caps and diaphragms. These are little plastic devices that you would insert into the vagina. Used to be quite popular, but they're actually not that efficient. So personally, I wouldn't recommend them. So what does that leave? It can leave a copper coil. Don't be afraid of a copper coil. These are little devices that are fitted inside the uterus and prevent pregnancy. And you can learn more about that in one of the other videos. If you don't mind hormones and want to try it, great. There are loads of hormonal methods. Your options are less limited. Now, we split hormonal methods into combined hormonal methods or progesterone-only methods. So the combined ones have the estrogen and progesterone. And the beauty of these is that you tend to give people a regular bleed. So you can predict when that bleed is going to happen. And some people love the security of knowing that. Combined methods are not for everybody though. People with certain health conditions may make them not suitable for this. So that's always something to consider. So don't get your heart set on something and then come and see us and we say actually it's not going to work for you. The combined methods come in the form of pills. They can also come in the form of a patch that you put on your skin, a bit like an anti-smoking patch, and also a ring that goes inside the vagina. And again, you can learn more about these in a separate video. If you're not suitable or you don't want the combined method with the estrogen and progesterone, there are progesterone-only methods. Now, these are either pills or an injectable form that you get every 12 weeks, or an implant that lasts for 3 years, or intrauterine devices which last between 3 and 5 years. Really safe, really effective methods. The only drawback that some people find is that the bleeding can be slightly less predictable, but that's not a reason not to use them. And again, you can learn more about these different methods in the separate videos. Okay guys, good luck choosing, and obviously come in and discuss anything you want with us.